guys. Welcome to Harry Matters 7. We've been at this for a while now. I am the world's greatest moderator, Averbs123. I'm joined here by Andy1 and Donna, who's been one of the primary reasons for having our guest of honor on this podcast, Dr. Taleb Bargouthi. Today, what we're going to talk about is a little bit of his transplant clinic and his hair restoration clinic that he runs in Jordan, and also the very exciting work he's been doing with Verteporfin, which has made its rounds far and wide around the internet. So, well, first of all, thanks so much for joining us, Dr. Bargouthi. We're so excited to have you.
Thank you very much for having me. It's a pleasure, and I hope this will be informative to everyone joining in.
Yes, absolutely. So just for the audience to give a little bit of background on Dr. Bargouthi, he's one of the top hair transplant surgeons in the world. He's based in Jordan. His clinic is called Vertex Hair Clinic. Importantly, it's a fully integrated hair restoration clinic where they're not just doing transplants, but they're doing scalp disease management and also prescribing patients sort of all alternative forms of hair loss treatments. Which I think is very important. So you don't necessarily have to go to him, just at the point when you're looking to get a hair transplant. He's a graduate of the Royal College of Surgeons in Ireland. He then sort of pursued higher surgical training on ontology. Can you help me pronounce that word, Dr. Bargouthi?
Yeah, so it's otolaryngology, which is basically ear, nose, and throat disease and head and neck disorders.
Gotcha. Okay, and then you pursued a fellowship program in Portland in the U.S., I believe.
Correct.
Where?
No, actually in Texas.
Oh, in Texas. Okay.
In Texas.
All right, so they got your bio
Yes,
wrong on the hair transplant network. Good.
That's probably because I don't know. I actually didn't notice that, so we can look into that.
Okay, cool. And in that fellowship, you were primarily focused on sort of learning the FUE and FUT, or was it?
So luckily in my fellowship, I was exposed to FUE, FUT, and also medical hair restoration. So I had a lot of exposure to female hair loss issues and also to non-surgical hair loss problems. So that was why I pursued my ongoing service is also focusing on non-surgical as well.
Got you. So just to get like a little bit more information on Vertex before we sort of get into Verteporfin. So how many people do you have working with you at your clinic? How many patients are you typically seeing? What's sort of the frequency of procedures you're performing on patients, et cetera?
Yeah. So we generally have, it's myself, and we have two new doctors who are associate doctors that joined us recently, actually. We also have a team of 4 nurses and then, 3 support staff. It's a nice team of doctors, nurses, and technicians. We usually perform 1 procedure a day, around 5 or 6 times a week. In some cases, we have 2 cases that are smaller running simultaneously. At the same time, we have our regular, medical patients, consultations, follow-ups, certain scalp treatments, and we also do a lot of prosthetic hair systems in the clinic. So we actually do that part as well. And it's something I'm also interested in terms of combining with hair restoration surgery. So it's a day that starts with surgeries, and then the day goes on with seeing new patients and follow-up patients.
Gotcha. Okay, awesome. So now onto the moneymaker topic, the thing that everybody's going crazy to hear about. I guess to start, what was the origin story or the genesis story of how you got involved with Verteporfin in the first place?
Yeah, so as you know, I'm part of several channels and a hair restoration network as a forum, and I'm always going through questions and threads that are something that I can answer or maybe shed a light on or just give my opinion about. So I came across a post there or like about this medication that could have a potential in wound regeneration. Um, and I read through it, and then I started a communication with the original poster, and I started reading about it and seeing that it's something that I'm aware of existing in the form of Visidyne or medication for age-related macular degeneration, which is an eye disease that has been affecting vision by forming new blood vessels in the retina. Um, so I looked into that and I realized I knew that Visidyne was no longer the treatment of choice for such conditions because I have family members with it, so I know that they're using something else and they've used Visidyne many years ago, and it's no longer the treatment of choice. So um, I started reading a bit more about this, and then I just said maybe we can do like a trial if I can source something, and I started contacting the original, producer of Visidyne, but I consulted with some ophthalmology colleagues, and they said, "Oh, it's an ancient drug for us now. I'll be shocked if you find it anywhere." So I looked in for manufacturers, and we were able to source some. So once it's there, we worked on the protocol. We kind of mimicked what or hypothesized what the dosage was done in animal studies and how we could reflect that on a human trial. And that was the start of it.
Got you. Wow. Okay. And just as a follow up, because we've had quite some difficulty as we've looked into sourcing Verteporfin. Um, are the manufacturers that you were originally able to source it from, are they capable of manufacturing more, or is this like we need to start looking for? Um,
I think they're capable. It's just they're putting more restrictions on, ordering it. I've contacted my original manufacturer and who's based, I think, it's a company based in Ireland, but they ship from France. I think that's the original route. And they keep on asking for or more justification for why is this being ordered. It depends on each order. So sometimes it might be a lot of paperwork, original research, institutional research evidence. Um, so it's one of these. This is one of the main obstacles, I think, with Verteporfin is trying to find a guaranteed, reliable, consistent source.
right. So now that we sort of understand why I guess you were interested in Visidyne in the first place, um, I know there's sort of a couple different mechanisms of action associated with verteporfin. One sort of being the reason that it was used for macular degeneration. Would you attribute sort of, at least in your hypotheses, the uh, the reason for verteporfin working being GAP1 inhibition? Is that sort of your main thesis at this point?
Yeah, I mean that was originally what triggered my interest. Is that we have evidence of how the YAP mechanism and pathway works, and an inhibitor of that pathway essentially shifts the pathway with no fibroblastic activity or positive activity. And in that way, you have less wound healing or scarring, I mean, less scarring and potential regeneration of original, skin structures. So this is what, you know, it sounded something, you know, logical, and something that has been uh, positively seen in animal studies. So, you know, it was a matter of making sure that we can actually test it, and that's where the interest, you know, took off.
Got you. Got you. And in terms of, you know, the patient perspective on why they should be excited for verteporfin, what would you tell sort of patients? Not necessarily that this will come true, but what is the like your, you know, your hopes and dreams for verteporfin, if you will.
Yeah, so I mean, if you think about it, it was originally, or initially the thought was, you know, looking at scarring, and that on its own is something that serves many people. First of all, even beyond the hair restoration, you know, pool of patients or clients. So scarring is one thing, which is, as you know, the other thing would be in specifically the hair loss community. You have patients who've had FUTs done before, so that's a scar that they will be happy to you know, treat in some way. The other thing is FUE scarring, or you know, a continual depletion of your donor hair, and replacement of these hair follicles by scar tissue, which gives, you know, eventually the appearance of thinning in the donor and less donor availability. So all of these patients were, you know, or you know, subjects were a target for the original aim for verteporfin. Um, Hair regeneration was maybe a secondary target. It was something that, you know, for obviously great, if that continues to show evidence. But as well, I think we should remember that the main, let's say, pathway that we're trying to prevent is that to do with scarring, and that also serves many people in terms of their old scars, other scars, or even FUE scars.
Got you. So just to recap for the audience, you have FUT, stands for follicular unit transplantation, where they cut the big strip out of the back of your donor area. It leaves a much bigger scar than FUE. And while there's smaller scars there, the idea would be that you're able to reduce the scarring, whether it's FUT, FUE, allow for regeneration of donor hairs, which then massively expands the donor area region that you're able to draw from. Uh, Ideally, in a perfect world, giving you unlimited donor hairs to fill up sort of the entire front and top portions of your scalp. Whether or not that's a reality, or whether or not verteporfin gets you all the way down that path, is what we're trying to ideally figure out from future work with Dr. Bargouthi. Uh, okay, so now that we've sort of outlined that, um, can we go through perhaps the trial that you ran with the patient? What exactly sort of the dosages were that you used, sort of what your findings were, and then what you would recommend as next steps.
Yeah, sure. So again, one of the when we first started with the trial, we wanted to make sure it's someone we can follow up with. So that's something that is important. And at the same time, we wanted to test the safety of the medication. Again, all of this is not a purely scientific, you know, trial. It's something that is done on a clinic basis, and you know, within the limitations of the practice itself. So we wanted a volunteer who's willing to have few hairs extracted. Again, we didn't want to damage the donor area unnecessarily. Um, so we wanted to take few test areas, try maybe different dosages, and you know, have a control and a test site, and be able to be followed up, obviously. So we did that. We took 3 areas of the donor scalp, and we tested three different dosages: 0.4 milligram, a 0.32 milligram, and a 0.24 milligram per square centimeter. And we had for each test area, which is a 2 by 2 centimeters, a test and a control segment. And we looked into the preparation of verteporfin, because the one we get is in actually powder form, so it's not pre-formulated. So we looked at the preparation, how to best dissolve it and prepare it in a liquid form, and precautions in terms of light sensitivity and injecting it. And what we did is we took a decent amount of follicles from each test area and from each control area, so they were equal. And at the end, we injected each test box, let's say, with verteporfin in a way where we kind of covered that dosage per square centimeter, but it's actually injected over different areas of the actual test site. And we then covered the area. We took, again, light precautions, not to subject it to any lighting. And we started following up the patient regularly. So at around, just to kind of summarize what we found there, is that, verteporfin seemed to be acting differently. So verteporfin injected areas, they seem to be acting much slower than the traditional healing pathway of any FUE excision. So it has always been, initially, it's like delayed healing. That's probably the best way I can describe it. It's someone that is not progressing through the traditional healing process. And that was evident in the first, few months. We then started seeing sort of random, changes in the scarring in each test area, mainly at the higher doses, whereby, the wound sort of appearance looked a bit more, simply put, a bit nicer. It just looks like a nicer healing. And as that continued, we started seeing scattered hairs. Some of them are villous or fine hairs, and some maybe a bit thicker in appearance. So again, there's always a possibility that these are some telogen hairs that weren't seen, or maybe we thought of partially resected hairs, although we've tested the hairs that we've extracted, and there weren't partially resected hairs, so we excluded that part. But maybe some telogen hairs or of some sort that are present. Then we continued with the follow-up, and eventually we decided to do a biopsy of the area in one of the test areas. Obviously, biopsies are bigger in thickness or in diameter, so we didn't want to punch the volunteer in all the sites, so we just randomly picked up one test and control area. And again, the findings on the biopsy, the pathologist didn't know what we're testing. He thought it's a random hair loss patient. So we found more.
Just for the audience, I have the biopsy pulled up in screen sharing, so you guys can actually just reference the actual the text used by the pathologist.
Yeah, so obviously there was something different. He even reported that the test area treated sites, he only knew there's a test and a control area, but he didn't know the nature of the actual process. But he also commented that the findings in the test area looked much better than the control areas, and that is evident by the number of hair follicles and also the fact that there was no, perifollicular lymphoid infiltrate, no concentric fibrosis in the test area compared to the control area. So, that was also a positive thing, having some sort of an objective, measure regarding that. Um,
So, Dr. Bargouthi, I mean,
yeah,
just to to ask the question that I know a lot of the hair loss people are very curious about, like, so we're seeing, at least in the high dosage, we're seeing twice as many hair follicles in the portion that you tested the verteporfin on as the control section. Like, do you find is that do you find that encouraging for sort of future use? Is this
yes, of
yeah?
course. I mean, this is what encouraged me with the findings, and also with the final sort of, or not the final, but the last follow up with the patient, where I thought that the appearance looked, to me, very encouraging, and in terms of skin appearance, but also in terms of coverage. So um, this is what sort of made it, maybe more important to do further testing.
I'm gonna interrupt. I'm gonna interrupt right here. That's okay, Verbs.
Yeah, yeah, go for it.
Okay, so yeah, I'm gonna can I drill down on this $1 million question, right? Like, clearly, we're seeing, and you can see in the screen share, double the hairs in the test region. In these like pictures, 1.5 years in, clearly these test regions look like fuller in the control regions. Like, you can kind of see my mouse. You can kind of see like there's in the control region there's these like empty tissue, scars. Well, it seems a lot more like evenly distributed in the hair in the test region. If you look at them, the magnification here, the control region just
Yeah,
has, huge regions of just like scars, right? Like a bunch of like, whitish scars.
yeah,
Over here, it looks like, a lot more hair, even the like areas where that don't seem to have hair, it's like maybe some hair growing, like, like, and, correct me if I'm wrong, but like, like, what else do we need? It seems like so much evidence, both objective evidence and pictures evidence showing that there is regrowth. Like, why can't we be
but the main thing, to be honest, is that it's one patient. I mean, I know this is very exciting, but at the same time, we have to be scientific, first of all, and also we have to look at different things, different doses, different mechanisms, more objective measures. It's something, with the hair loss community and hair loss cures or solutions or promised cures, there has been a lot of medications or promises that came out in the past.
Hope.
So, we hope, yeah, we don't want to be driven by that, or we don't want to drive people to something that, um, I guess, not drive them, but we have to, present something that can um, sort of outrule any skepticism, or and rightly so. I mean, people have all the right to be skeptical in some cases, and also, not be too ambitious or hopeful, and that has been driven by, years and years of false promises, and all drugs being tested and then disappearing, and we still see it. So it's just the duty to provide a scientific and an objective measure, and to be, hopefully as transparent about it as possible, and just show what evidence we have day by day, or not, I mean, as we go with the future testing.
Absolutely, absolutely. I think it is very exciting, but we do have to acknowledge that this is an N of one study, uh, and so yes, we do need to be intellectually honest and stay scientific. Um, and I believe, and maybe this is worth touching on now. I think that's where HairDAO came in recently and with our proposal, which was written by Endana and which passed, and we're very excited about. We ordered the Trico Labs machines, and maybe Dr. Bargouthi, we could just talk a little bit about what the goal is there, with the Trico Labs machines, uh, and and also just how HairDAO could continue to support your efforts here. How the members of our community could help in any way, whether it's uh, flying to Jordan to participate in the next round of Verteporfin transplants or whatever it may be.
Yeah, absolutely. I mean, HairDAO and I don't know the exact numbers of the entire community, but I'm sure there's a sort of an overlap between members in HairDAO and also in various forums. And everyone has been very supportive. And actually, we have an ongoing trial that has been community driven and supported, and that is still going on, or planned to go on. Again, limitations of medication, limitations or the need to have objective studies have pushed us to do that trial, with the best possible tools. So that was why it has been pushed several times, and also for volunteering purposes, we needed someone that is always there. So um, apologies for any delay that has been pushed back several times, but it's not easy to convince people sometimes to be present weekly into a clinic, and also to have the right tools to look at everything. So that's one thing. HairDAO has been very helpful and supportive. As I said, we're looking, or we have ordered the Tricolab system, which allows very good and accurate photos of areas in the donor area and in the scalp. And also, it has an artificial intelligence element where, we can track or sort of do a virtual tattooing of the area that we're looking at. So instead of physically tattooing patients, we can actually go back to the same area with more objectivity. And it's one of the, the great systems that have been used in hair research over the years, and this is their latest software upgrade. So um, it's very exciting to have the objective part of the study covered, or at least we have the tools to do proper or provide proper research material. The other thing would be finding patients, and also sourcing the medication, which is always something that I want to be very comfortable with in terms of being able to provide it, because what use is it if we can't find it? At the end of the day, this is the main thing. And these are things that we could get help with, is sourcing, uh, recruitment, and also obviously the technical support.
Got you. Got awesome, awesome. All right, so HairDAO community, you heard it. Let's get on it. I had two more questions, and then I think Andy one was gonna just take it away with a couple community questions. The first question was, how are you thinking for follow up? So the highest dose, the 0.4 milligrams per, or was it milligrams or milliliters per square centimeter?
Milligrams.
Milligrams per square centimeter performed the best. How are you thinking about dosage in follow up sort of experiments? Like, it seems like we want to start maybe testing the upper bounds of dosage.
Correct, yeah. So I think point four will still be in the picture, but also we're going to go slightly higher. So it'll probably be in the point six region. In some ways, I think the higher dosage did not perform well in other studies, but I think maybe staying around. the zero point 0.4 mark is good, because the 0.32 was also quite promising in the initial trial.
Gotcha.
Basically, I believe the biopsy results was on the 0.32, to be honest, because we randomly selected the area.
Gotcha.
Just to follow up here, like, so I was a little bit curious about this. We just found out in the pig studies they actually use 0.18 milligrams per centimeter squared, which is actually lower than the lowest dose tested so far. And yet, it seems like the higher doses are working better on humans, despite the pig skin, being very similar to human skin. But at the same time, we've seen that, like, for the studies, the higher doses are actually worse off, or at least the higher concentrations are. So, like, what's happening here? Like, why is the human skin reacting differently than the pig skin? Is this expected? Should we be careful? Should we try 0.2 again? Like, what are kind of your thoughts there with this discrepancy between the pig skin and?
I'm definitely gonna try a dose of like the 0.2 dose region, because I don't know if I mentioned that before, but with the 0.24 that was done in the trial, we actually used a similar environment to a typical FUE. So we used tumescent fluids, and we used adrenaline in the site itself. So we kind of wanted to have more local action of verteporfin in that lower dose, just to see if it actually, triggers more action, and also to get some insight on a traditional FUE, if whether there will be any sort of interaction between, injections that we use in a typical FUE. So in the next one, I'm keen on trying the same dose, but without any sort of interference with other medications like adrenaline or lidocaine in the actual test area. So it's fine if it's blocked beneath it, but I don't want it to be in the actual extraction area.
Got you. And then just the last question I had before turning it over to Andy one, in terms of verteporfin's use in macular degeneration, I know that it was important to be photoactivated. Have you considered or thought about photoactivating the verteporfin when you inject it into the donor site, or does that sort of not make sense based on your understanding?
I think the activation part in vascular in macular degeneration was that because verteporfin is, as far as I know, it would be intravascular, so it was injected in the vessels, and then it needed a certain wavelength of light therapy to activate it throughout the retina and the vessels. So at the same time, this is not something that we should outrule or neglect. But the only thing is, we know it can be inactivated by light as well. So given the deficiency we have, or the limited resources we have in terms of verteporfin, we didn't want to go with the obvious damaging effect.
Right.
So that's why the lighting precautions were taken. Obviously, if we have more, subjectivity, or we have more availability and more subjects, we can look at, exposing the area to a certain wavelength of laser therapy or laser light, maybe a low-level light therapy, to see the effect on the skin. But what we know is that it can cause it's photosensitive, and it can cause, a reaction under the skin if it's subjected to light. So
Got you. All right. Thank you so much. Turning it over to Andy one for community questions.
thank you.
Yes, Dr. B. So just a few questions from the community. If you're watching at home, would love to have you join the community. Excuse me, sorry. Anyone can join. Anyone can ask these questions, but these are from select community members. So the first one from Cat Belly Rubs. So Dr. B, do you believe that verteporfin in FUE procedures can be scaled for 2K plus graft transplants? And just to clarify, by 2K, not in cost, but in terms of the number of grafts that could be used in a hair transplant.
Yeah, I mean, obviously, by what we know about the medication and by what we know about the so far in the several studies done, is that it's a safe medication. So in terms of volume, and we're also dealing with small volumes per square centimeter. So you're talking about, in a zero point 0.4 milligram, as a 2 milligram per mil concentration, you're talking about 0.2 cc's of injection. So once we have, a full donor area, I wouldn't be worried about, the number of injections or the volume used in a full FUE procedure. And I don't know if you know this, I actually did that already. We did a full FUE. It's undisclosed because yet no one, it wasn't part of any trial or anything. It was purely based on patient interest and the medication was available for him. So we did that on a full FUE already. So it's not something that is difficult to do, but we just have to see what the results would look like.
Amazing. I'm sure people are going to be very, very excited to hear that. So our next question.
It's unfortunate. I mean, as I said, it wasn't constituted as part of the next trial because anyway, we didn't have the material to run photos and to do all of that. But theoretically or, practically, it was done on a full FUE. So that can be shared.
That's amazing. I mean, I'm sure it won't be the last time. So yeah, I'm sure hopefully we can get some data on that in the near future. Amazing though. It's very exciting. And so our next question from Nick1234, actually not about FUE transplants or FUT transplants, but about plucked hairs. So some quick background for the audience, obviously. Plucked hairs, if you pluck a hair from your scalp, the plucked hair will grow back in the donor site, but not where they're implanted normally. So this question is actually about using Verteporfin in the injection site or implant site. So do you think, Dr. B, that hypothetically, Verteporfin could aid in the acceptance of a new follicle in the recipient site? So where the follicle is ultimately implanted, with the goal here, I think what that Nick is thinking, potentially being able to use plucked hairs in transplants as potentially something new and innovative.
Just to elaborate, the reason we think plucked hairs themselves are innovative is that in a plucked hair, the stem cells actually cling to the bulge of the plucked hair follicles. So, if we're able to apply Verteporfin to, the stem cell area, that's kind of what makes these plucked hairs particularly unique.
So it's using them in the recipient area and having Verteporfin injected in the recipient area. Is that
exactly?
I mean, again, I don't know. I mean, obviously, if there's any stem cell element in these hairs, that's a promising idea. The only thing is, Verteporfin, as far as we know, requires some sort of injury. So if that is coupled with needling or in the recipient area, obviously, which is needed anyway, but with plucked hair, I don't know, the size of the microneedling might be much less, much smaller. So I think it's important to have a wounding mechanism. But with plucked hair, to be honest, I wouldn't know. I wouldn't think that I would know at this stage unless it's something that can be tested.
Yeah, I guess to clarify as well, is it would be like a normal FUE in that basically there would be no donor injury. You would just pluck the donor, but the incision would still exist in the recipient. So you're still wounding the recipient. A lot of people wanted to test, if I wound the recipient, will it just grow hair? But on top of that, what we're actually doing is that we're making it better by adding a plucked hair into the recipient site. So that's kind of like a two-step process where one, we add wounding to the recipient site. We also add implant this plucked hair with Verteporfin. So, the goal is that, doing these two combined potentially could create a DHD insensitive hair.
Yeah. Yeah, I mean, it's an interesting concept, but I think it's something that has to be tested because of other also other maybe limitations is that in terms of like actually using a plucked hair without verteporfin, maybe starting off with that and seeing the rate of growth in that area and then adding verteporfin to it.
Fascinating. Yeah. Yeah. Hopefully something we can test one day. But yeah, obviously I'm not, yeah, I mean, hopefully something we can test one day. We'll see. And then the last question, Dr. B, this is actually for myself. So, uh, we kind of view as a pioneer. They're not. I mean, you're, at the forefront of both transplant surgery, which is a very difficult task, and then also research, which is also something that's not easy. We're curious: is this the first instance of verteporfin used in people for scarring? I guess I should clarify and say for skin scarring specifically. Um, but we weren't aware if anyone's. We're pretty confident that you're the first person to do this in people.
I think no. To be honest, I think there are people who used it on their own. Um, I think verteporfin has been injected by individuals who sourced the medication and got it injected either by themselves or maybe by other doctors. I think this happened in a scar. I've seen it on several groups where there is an injection of some facial wounds or maybe scar revisions that was done last year sometime. So I think it has been done on by individuals. I'm not aware of doctors doing it, or maybe they're undisclosed, or they have done it to that particular person. But I know it has been done on facial scars and body scars, either by the patient himself or by a nurse or a doctor assisting them.
Got it. Got it. Very cool. Well, we still view you as the pioneer of it anyway. I think the whole hair loss community is in debt to the work you're doing. So much of it, like just out of goodwill and pursuing science and truth, which is something that we keep, I think, at the heart of our ethos. And yeah, just really really grateful that you've been pushing this forward for everybody.
And I'm grateful for everyone as well in supporting. And I understand the delays, the limitations, and the anxiety, and also the you know um, the excitement of it. So at the same time, we have to have a balanced approach and to try and be as objective as possible. And that's why it can sometimes be delayed or even we ourselves are not sure of where this might end. I'm excited, and I would like to share this excitement, but at the same time, I have to be aware of everything that has been happening in the past. So we just have to, tackle it one step at a time.
I just wanted to elaborate. I've been working with Dr. Bargouthi on this for almost the past year and a half. Like, it's been crazy. How much he's helped. Like, we started with just an idea. No other doctor is willing to try this, but Dr. Bargouthi, he really, I think, he really believes in like progressing the science. Making the patient experience better. I think I just really want to emphasize how grateful I am and the rest of the community is. Like, this. Hopefully it's a cure. There's a good chance it might not be, but at the very least, we know we tried, and that's all we can ask for.
Absolutely. Yeah, and you've been helpful as well. I must say, everyone in HairDAO and in the communities and forums have been very helpful and very supportive. And I hope this will, materialize into something helpful, and everyone can, be excited about. The other thing is, maybe I want to elaborate, is that I get a lot of requests about protocols being shared. The only thing is, um, I think it's difficult to just share with random or with patients a protocol, because I really don't know how the use is gonna be. So it's quite difficult for me to, as much as I would love to, it's a bit difficult for me to just randomly share protocols on how to inject, because essentially it's coming from me, and if there's any, liability, that would be entirely mine. So uh, for anyone there who's looking to have this maybe tested by their doctor, or following a procedure, I'm happy to share that with a medical practitioner, maybe that are looking after them, just to ensure everyone's safety. But it's hard for me to share, and I'm sorry about that. But it's hard for me to share just with the community members, because I really don't know the use of that, or how it's going
Yeah.
to be used.
Yeah, no, I think it's really important to note that all the work you're doing is on a per patient basis, what you think is just best for the patient, which, um, yeah, it's just really admirable. Yeah, no, 100%. Any doctors we share with, we should definitely get them to just sign a confidentiality agreement, and share with the doctor only the protocol. I think just to yeah, make sure you're protected for all the work you're doing.
No, it's just making sure as well that it's not done by the person himself, on himself, or on someone else. That can be something dangerous, and we don't want it to have any negative publicity in any way. We just want it to move
Yeah,
forward.
100%. Well, that's it from the HairDAO community questions.
Yeah, yeah. No, I think this is it. I think Hair Force, I hope you enjoyed that episode. I personally found it fascinating. We're engaged in all of this, basic research, and this work with Verteporfin is by far one of the most important studies to follow if you're suffering from hair loss now and want something that could theoretically, help you in the much more short term than a lot of this longer term basic research we're doing. I just want to second. Not nearly enough people are innovating and experimenting in science in general, let alone in hair loss. And so we really, just owe Dr. Taleb Bargouthi a lot for not just focusing, on his clinic every day, but being willing to really think about hair loss and push the field forward. So it's really incredible. We all are in debt to you. And yeah, I hope you guys enjoyed this episode of the Hairy Matters podcast. Thanks so much, guys.
Thank you, guys. Thank you very much.